A brow lift is a procedure done to elevate and move the position of the brow. Some patients come in and feel like they have excess upper eyelid skin, and really what they have is, and they may in fact have excess upper eyelid skin. In addition to that, they have brow ptosis, so they have a low eyebrow, so their brow is sagging down. In those cases, we recommend a brow lift. Now, a brow lift can be done as a standard open brow lift where an incision is made across the top of the head and the skin is sort of peeled down, then we lift and tighten that skin up. That was the traditional way to do it. Nowadays, we use the endoscope, and you're doing an endoscopic brow lift. It's virtually an identical operation, except that rather than a long incision across the top of the head, we make 5 small incisions across the hairline. We stick a TV camera, and then we do the operation while we look at a monitor. The advantage of that, of course, is that you don't have the downtime of all the incisions. And there's no real sensory loss or very little sensory loss to the scalp. Obviously, the purpose of this operation is two. One is to put the brow into a better position, and the other one is to try and decrease some of the lines that a person might have in the glabellar area and in the forehead. And it's amazing that once you have elevated the brow to a new position and then sometimes taken out some of those muscles in the glabellar area, that not only do you now have the brow that looks better and the patient looks more refreshed and less tired, but the lines that they have in their forehead are gone. Brow lift can be done under local or general anesthesia. It's a relatively limited procedure, that is involving just the upper face, so a lot of patients will prefer to have that done under local anesthesia. The downtime for a brow lift is probably a week, 10 days. Any sutures that are put in or taken out at around a week or 10 days. There's generally very little bruising with the operation and very little swelling. So again, it's usually well tolerated, and of all the procedures, probably one of the quickest recoveries.